Myeloma has been blessed with a number of new drugs which have improved the outlook tremendously, but there are issues that come from that. These drugs are very expensive, so that's going to be a challenge in the UK. In addition, we don't know exactly how best to position these drugs, what the best combination of these agents are, and also there's the question around continuous therapy and whether we should be using these for prolonged periods of time to try and improve outcomes for patients. And ultimately it still is, unfortunately, it's not a curable disease, so there's always an unmet need for patients, particularly in the relapsed setting. The survey that was sent out across the UK was really to see what the real world practice is for imaging, and it's quite clear that most centres are still doing skeletal surveys, so plain x-rays. And I just think it emphasises the gulf between guidelines and real-world practice, and it shows that capacity and cost is a major challenge in implementing guidelines. And I think real-world data tells us a lot more than trials, and it also shows us how effective guidelines can be, and maybe we need better levers from guidelines and better power for guidelines to change practice. So I think that's a big issue with all the guidelines that we do.